Dr. Sue Decotiis is a weight loss physician in New York City. She joins us now live. Dr. Decotiis, safe to say that men have mirrors and wives who remind them that there might be some extra love handles here and there. Is that what we're seeing? I guess the battle of the sexes and women are winning the war?
I don't know about that, Del. In my practice, I would say close to half of my patients are men. And they're very concerned about their health. They're very concerned about high cholesterol, insulin resistance. Their GPs are saying, your liver function tests are high. The other thing that they're seeing is testosterone is going down, and that affects their love life. So there are a lot of things that happen when you gain weight, not just the obvious high blood pressure and cardiovascular diseases, but also sleep apnea. You look and feel older. People that are looking for jobs in this competitive job market, going for interviews and not feeling good about themselves. People really want to trim down and they want to get healthy. And men want this just as much as women do.
Dr. Decotiis, I'm old enough to remember when there was nothing called a dad bod. When a beer belly was a source of pride, and being a fat cat meant that you had money. But nowadays, everywhere you look, you're seeing these men with a 8-pack. Most men I know have maybe a 2-pack or a keg. Is that why we're trying to lose weight?
I don't think it's all vanity. As I said, I really believe people are concerned about their health. Men that have families, they want to make sure that they're able to give their daughters away and put their kids through college. And their wives are saying, honey, you're just not healthy. You're keeping me up. You're snoring. You're not able to fit into the shirts that you fit into last year. And I see patients in my New York City practice. Most of these people are pretty well educated. They know how to eat. They might eat organically. They have a pretty good lifestyle. They play sports. They go to the gym, but they can't take it off on their own. And that's a sign that they're insulin resistant. So I put somebody on a body composition scale, and I can tell they're insulin resistant without even looking at blood work, just by virtue of the fact that their body fat is very high for their BMI. So when you're losing weight on these new medications, you mentioned Ozempic, which is semaglutide, tirzepatide, which is Mounjaro and Zepbound. All of these new medications work by balancing insulin. And they can be used for diabetes, but they're very effective for weight loss. So if you can't lose weight on your own with diet and exercise, you have to fix insulin. And insulin gets weaker as we get older. As our other hormones go down, insulin goes down.
Dr. Decotiis.
So when women go through menopause and men start experiencing low testosterone, a lot of times they're insulin resistant. And if we don't fix that, we can't fix the other problem. So it's very, very important.
The numbers bear out what you're saying, because Americans seem to have different views about who should be taking these drugs. 53% of adults say drugs like Ozempic and Wegovy and others are good weight loss options for obesity and other weight-related conditions. 62% say they are not. And they say if you don't have a weight-regulated condition, you shouldn't use them. Can you explain that for us?
I think people don't understand how important insulin resistance is. The patients that come into my practice would have loved to have been able to do this on their own, believe me, but they realize that they can't, and they see that they're losing the battle, and that's when we take medications. If I know that somebody has a healthy lifestyle, I know that they've been trying to cut back on calories, and I know that they exercise, and they can't take it off. I can't wag my finger at them and say, this is lifestyle. They need help. We don't want them to become diabetics. And everybody's concerned about the shortages of medications, and certainly we can't ration it, but there are definitely nationwide shortages of these drugs. So what happens many times is that when somebody goes on one of these platforms, like his or hers or any of these other things that you might see, it's often, it's frequent that this platform cannot obtain the medication. So I've had patients that seek my help and they say, I got ripped off. I went on one of these platforms and they took my money and they couldn't get me the medication. They couldn't get me Ozempic. They couldn't get me Mounjaro. What's going on? So there are nationwide shortages. The other thing that concerns me, and I know that you're familiar with this, that insurance companies are hesitant to pay for these drugs, even if there is an underlying condition. So if the patient is not doing effective weight loss, let's say that they lose the weight after spending thousands and thousands of dollars of their money or the insurance company's money on one of these drugs, and they gain the weight back, the insurance company is saying, oh, what's up with this? We don't want to pay for this again. So many patients that are losing weight on these drugs are not doing it the right way. It's very important that patients are followed with a body composition scale. And that is the cornerstone of how I practice with my patients. I have to be sure that they're losing fat and that they're not losing muscle. That's impossible to do unless you're seeing a physician that uses the scale and has a lot of experience with working with these patients. So a platform where you're just having some doc or a PA write a prescription, I don't think is the answer.
So let me ask
People
a question.
are going to regain that weight. It's a total waste of time and money.
Is this a fad? We had keto, we had Atkins, we have Weight Watchers, we had CrossFit and intermittent fasting and liposuction. Will we be talking about weight loss drugs in 10 years saying it was not just another fad?
Absolutely not. They're going to get better and better. I'm excited about a new drug called retatrutide that should be coming out. It's another Lilly drug in about a year, and that works on 3 receptors in the GI tract and the gut. It works on GLP-1, which is what Ozempic works on, GIP, which is what Mounjaro works on in addition to GLP-1, and it also works on glucagon. So I think that's going to be even more of a powerhouse of a drug, and I think we have many more powerful drugs in the pipeline. And hopefully some of these drugs are going to be cheaper to produce so that they're going to be, it's going to be much more economic for people to either buy them themselves or for them to get insurance coverage. So it's really an exciting time. So this is not a fad.
Are we taking the easy way out? I once heard a person say that we look like 15th century British royalty because we eat like 15th century British royalty. And there is a thread on social media now that shows people in the 1930s and 1940s. And guess what? Mm-hmm. They all look lean and mean. So is it that we are lazy when it comes to exercise? We don't do much physical work? Or are we eating now more than any population in this nation's history?
Well, we are eating a lot, that is for sure. But you also have to think about the patients that I see. I've reviewed their diet and their exercise routine, and they're not eating that much, and they're trying to lose weight. What about the whole thing about chemicals in our foods and in our environment? Okay, that is what you've seen the great increase in since the 1930s. They started putting chemicals on our food, and there are chemicals in our soil, pesticides, et cetera. It's not just about processed food. Even organic farms have chemicals in the soil. So this is definitely a big thing, but that's going to be very difficult to eradicate. So what we're left with is insulin resistance, and I'm a physician, and I'm practicing in New York City, and people come in and say, help me. So I'm doing the best job that I can by prescribing these medications and using them carefully. That is really the only way to combat the insulin resistance. And in my practice, I'm very successful in getting people off of these drugs. So what I do is I titrate the doses down after we get people to where they need to be with their ideal body fat. So I don't believe that people are going to need to be on this forever, which is what some people are saying. I think they don't understand that if the patient actually loses body fat and they're able to maintain muscle and hydration, drinking a tremendous amount of water during the process is key. And many doctors are not telling patients to do that. That people can keep this weight off permanently. And many of my patients have done that. So I'm really happy about that.
Doctor, 30 seconds left, but how concerned are you that people don't pay attention to the fine print? I'm always amused at the fine print right at the end of the ad where they say side effects include diarrhea and death. I don't know that one of these drugs has that as a side effect, but what could be the worst that happens if we take one of these drugs?
Well, if you have an underlying condition, endocrine condition called MEN, which is very, very rare, you should not take the drug and your doctor should screen you for it. There are some other reports about people having really slow gastric movement, but that's really reversible. It's not going to kill anybody and it's going to go away as soon as they take the drug. I really have not seen any serious side effects. Once in a blue moon, you might see someone who's gotten pancreatitis with Ozempic. I have not seen it with Mounjaro. Otherwise, I'm sure, as you can realize, the trial lawyers will be all over it. But I think these drugs are safe because they're peptides, and peptides are things that occur naturally in the human body. So these are peptides that are synthesized in a lab, and peptides are simple chains of amino acids that function in the body to do certain things. And our whole body is wired by peptides. You and I are talking, conversing, because peptides are controlling our speech and our thoughts and all sorts of things. So they're pretty copacetic with the body. So I think it's a pretty safe group of medications.
I just want to say for the record, I do not have a weight problem, at least from here up. Dr. Sue Decotiis, thanks for being with us tonight.
Thank you so much.
When we come back, how did one U.S. senator affect the reproductive rights of millions today? More about how a Senate voting quirk led to a political showdown and a battle that is literally playing out over the meaning of life. Stay with us.